Welcome to episode 13 of my podcast. In the past episode 6, we had a very good discussion about Parkinson's disease, and some of you has messaged me and asked if I could discuss more about Parkinson's disease. And as we know, Parkinson's disease is the progressive disease of the nervous system, which is manifested or marked by tremor, stiffness, slow movement, and balance problems. And so today our conversation is about why exercise matters in patients with Parkinson's disease, and also what are the best exercise programs for patients with Parkinson's disease. So let me introduce my guest today, and she is a former wellness coach. She has a degree in Bachelor of Science in Kinesiology from California State University at Fullerton, and she is also currently a care manager at Arosa, home care in Orange County. So let's welcome my guest, Jessie Bueller. Welcome, Jessie.
Hi, thank you, Dr. Protasio. Just a little bit more background information. After I graduated from Cal State Fullerton with my degree, I worked for about 7 years as a wellness coach with seniors, so 65 years and over. And then after that, during COVID, I transitioned over to working in assisted living communities as a caregiver and director of memory care, as well as an activities director for memory care. And now I'm at a home care company that provides caregivers in home.
Thank you, thank you. And also kinesiology, I look it up. It is the scientific study of the human body movement. So as a former wellness coach, what does it mean? Can you share it with us?
Sure, yeah. So let's say you're a new patient coming in. We would do a full-on fitness assessment on you. So we'll get the health questionnaire, see if there's any issues with certain movements, things like that. If you say you have Parkinson's disease, then we can go through a little bit more of an assessment. Also on SMART goals, so specific, measurable, attainable, relatable, and time, frequency of time, right? And then also do some physical fitness tests on your strength, endurance, flexibility, and balance. So we'll kind of go over that, create a program for you, teach you how to use the equipment, as well as we taught group exercise classes and did reassessments.
So it's like assessing first, like pre-screening before they get started.
Correct.
So how do you help your clients that are generally fit achieve their goals? Those fit that without like the Parkinson's. How do you help them?
Sure. So we want to make sure that the goal is able to be measured. So let's say they want to be stronger to lift their grandchild up that's like 20 pounds, let's say. So we'll do strength testing on some of the exercise equipment specific to the lower body, maybe some upper body machines as well, to see where their baseline is. And then after giving them a strength training program, we'll be able to reassess if they got stronger enough based on the criteria.
That's good. So before they get started, you are already assessing them, okay, they're capable to do this or to do that. Oh, that's good. That's nice. And you mentioned also that you worked in assisted living community in the past, right? And you had patients with Parkinson's. So I would like to share with our audience that Parkinson's has 5 stages, because understanding these stages would help in managing the disease and at the same time planning the care when the symptoms progresses. So the stages of Parkinson's is like stage 1, that is when mild symptoms do not interfere with the daily activities. Tremors may occur on one side of the body. In stage 2, symptoms worsen, affecting both sides of the body. Daily activities now become more difficult, but the person can still live independently. Now on stage 3, the balance problems and falls become more common. The person may require assistance with daily activities. Now in stage 4, there are now like severe symptoms, including stiffness and difficulty walking. The person may need help with most daily activities and may be unable to live by themselves. Now when the stage 5 comes in, that is the most advanced stage, where the person may be unable to walk or stand without assistance and require constant care. So understanding the 5 stages now, is there like one best exercise for patients with Parkinson's?
So according to Parkinson's, as well as all the studies that have gone on through Parkinson's, there is no one best exercise. There's actually 4 different types of exercise that they really say is the best, but having them all combined into like a mixture of exercises is most beneficial.
Yeah, there is actually, I did a reading also on that, that there is no one best, no one best exercise for them. You have to look at what stage they are. And then in the website of the American Parkinson's disease, they mentioned about the 4 core elements of exercise in patients with Parkinson's disease. Can you share it with us?
Sure, yeah. The first core element is aerobic exercise. So really anything that gets your heart rate increased from your resting normal heart rate. So that could be walking briskly, jogging, anything kind of like that. Another one is strength. So lifting weights in the gym is a good exercise to do. So that's just going to increase the strength of your muscles. Flexibility, so you want to be able to be flexible and move through your full range of motion, so doing stretching exercises, yoga, stuff like that, as well as balance. So any balance exercises could be like Tai Chi, yoga, dancing, Zumba class, anything like that.
Yeah, that's good, thank you. Now, if we are to consider these 4 core elements and also the 5 stages of Parkinson's disease, so if you are going to create an exercise program, what would be your recommendation?
Sure. For stage 1, a lot of the times it's not really diagnosed that early on. So some of the time, you know, the family does notice there's little things that are happening. Some changes going on, but it's not too noticeable. So usually by stage 2, they're really seeing the differences in the normal movement of the body. So trying to do as much as you can in your normal life, you know, with those 4 core elements. So aerobic, if you love to swim, keep swimming. If you love to run, maybe jog or walk briskly, things like that. And then strengthening, you know, use free weights at the gym. Body weight exercises, the machines.
Probably the stretch bands, you know, the
resistance bands, correct. And then balance, you can go to Tai Chi class, anything that really gets your balance, like line dancing is fun, so do something like that. And then flexibility, doing yoga, just doing some stretching on your own as well.
And then be sure that, you know, it's safe, for the exercise is safe for them before they try to, you know, do all those things. So that's good. I read an article that says that adding a cognitive component into the exercise on patients with Parkinson's is beneficial for them. Can you share your thoughts on that?
Yeah, so Parkinson's disease does affect the brain. So if we keep the brain thinking about different movements, different things, that'll help slow the progression down. Let's take line dancing, for example. Teaching someone a new routine or a new line dance, having them remember the steps, really concentrate on the way, the direction that their body's moving is really good for them cognitively.
Right. Because these cognitive components of the exercise, it helps exercise their mind. And the data shows that nearly all patients with Parkinson's, they will experience a certain degree of cognitive change along the way. So if you incorporate it, they kind of tend to learn new motor skills that kind of, you know, activate the mind. So that's good. So as a care manager in Arosa, can you share with us what Arosa is and what you guys do?
Yeah, sure. So Arosa is actually all over the United States.
Oh, really?
Yeah, we're in about 14 states, so we're pretty spread out. There's
nice.
a lot in California. I work at the Orange County office. I'm all over Orange County. My job as care manager is to assess the client and see what the needs are, whether it be they need a caregiver to help them with their activities of daily living, if they need resources like transportation, medication management, anything you can think of that they need help with, we're able to help provide those resources. As far as Parkinson's goes specifically, I work really closely with the Parkinson's Foundation. In Orange County, we had a walk, the Parkinson's Moving Day Walk, and got into contact with a lot of resources there. One of the ones that I volunteer at pretty regularly is called I Am Movement. It's a gym location in Irvine, and they provide the Rock Steady boxing classes. So with that class, it's great for balance. They're moving around, they're boxing, they're punching, as well as there is a cognitive component to it.
Yeah.
So as they're boxing, let's say they're saying numbers, they're adding up numbers and doing what number 5 says to jab. They're moving around the gym, doing purposeful big movements. So it's just a nice community of a group of people that have the same disease, that are going through the same issues, and they all come together to try to work to beat Parkinson's.
Yeah, that's nice. And I think it's good for a group of people with the same goal and with the same, like you said, they exercise together with the other patients with Parkinson's. So now there is a feeling of like belonging, because sometimes there are days that are good, there are days that are not good, you know. So your exercise tend to be a little probably better in some days and lagging in other days. So that's nice. That's very nice. So if there is one thing that you want to share with our audience right now, what would that be?
Yeah, I think for exercise, as long as you do it safely and have a lot of fun, any type of movement is good for your body. Especially when we talk about the later stages of Parkinson's disease, movement gets very difficult for them. So doing seated exercises instead of standing up, that minimizes that fall risk, as well as toward the later stages, the end stages of Parkinson's disease, where they're wheelchair bound or they're bed bound. Just doing even range of motion where someone's helping lift your arms up is great exercise and movement for you.
Yeah, that's true. So you kind of like they have to see first that the exercise is safe for them before they start any movements, right? Because in Parkinson's, at a certain stage, like what we have discussed, there would be a balance problem. Their stability is kind of decreasing. So thank you so much for sharing your insights and your knowledge about these exercises. And Parkinson's disease is a very complex disease. It is a disabling disease, and that's why it is one of the reasons why I wanted to raise awareness to this disease. So before we end this conversation, I would like to share that before starting an exercise program, try to check with your primary care physician and the neurologist if the exercise is safe for you. And then try to get a referral to the physical therapy who has like an expertise in Parkinson's disease, so they can give you, a good exercise program. And also, if you could ask like exercise programs that you would enjoy, and that would incorporate also the core elements that you mentioned, the aerobics, stretching, strengthening, and the balance, right? And also if they could add that cognitive component. So lastly, I would like to share this quote that I read by a novelist and a writer, Rachel Goodrich. And it goes, "Don't ever give up. Don't ever give in. Don't ever stop trying. Don't ever sell out. And if you find yourself succumbing to one of the above for a brief moment, pick up yourself, brush yourself off, whisper a prayer, and start where you left off, but never, ever, ever give up." I think it's a very profound quote that I would like to share. So I hope our discussion with Chessie, that you find this episode informative for you. And if you have any suggestions or topics that you want to be discussed in my podcast, just send me a message and we'll include it in our discussion. So thank you so much for watching. Click the subscribe button and I'll see you in the next episode. Thank you so much and blessings.